In daily life, we do 1,000 little things without even thinking. After a stroke, the simplest activity can become a challenge.
My mind is troubled, it's garbled sometimes. Simple things I used to be able to do, I can't do anymore. I can't look at a round-faced clock and tell you what time it is.
Many things that we could do very easily can become difficult. The clarity of thinking and the ability to understand our world may change and become harder. Stroke can affect cognition. Cognition means knowing information. This includes your ability to think, concentrate, learn, and remember.
People's ability to pay attention to a specific task, people's ability to concentrate, all of these things which we need to do tasks as simple as tying your shoes, people have difficulty with.
Common problems can include decreased attention span, reduced memory, reacting on impulse without thinking, difficulty transferring skills. For example, you may be able to perform a task in hospital, but not when at home, and a general lack of insight and judgment.
Part of the rehabilitation is working on things like thinking skills and looking at the cognition, the thinking, and seeing if there's things we can do to help stimulate that and focus it and encourage that the memory's good, that the attention is good, that there's focus there, and there's learning that can happen day to day to day through physiotherapy, occupational therapy, through speech-language pathology, and even therapeutic recreation, which is, fun, enjoyable, but there's a lot of learning and stimulation that goes on in our therapeutic recreation programs as well.
Stroke can also affect your perception. Perception is what your brain does with the information it gathers from your senses. Common problems associated with this include time distortion, for example, a lack of awareness of time; visual neglect, for example, bumping into things on one side; vision problems, for example, double vision; difficulty judging distance, for example, missing the edge of a chair when sitting down.
They'll be experiencing things like not being able to attend to one side of the body. So, from me looking at you, I'll be able to see your entire picture. But for those who experience perceptual changes, what we call it, they will only see almost half of your body or things that are occurring to one side of their field of view.
And then the last one over here, what does this say?
Stroke can also affect communication. Communication problems can occur in a variety of ways. Dysarthria produces slurred speech so that people cannot speak clearly. Apraxia of speech means difficulty initiating speech or struggling to pronounce words. Receptive aphasia means difficulty following instructions. Expressive aphasia means difficulty finding words, speaking in sentences, and communicating basic needs. And cognitive communication disorders leave stroke survivors disorganized or unable to follow conversation.
So it can be as minor as just a small, what people would call slurred speech, where it's still very intelligible, which means you can still understand what they're saying, but you need to pay a little bit more particular attention, to very mild word-finding difficulties. So you'll notice in a conversation somebody's trying to explain maybe their past life, their history, their family, and they'll kind of have that, what's that word? And they'll have to think about it, and then it'll come out. To someone as severe as not having any verbal expression and having severe difficulties with the comprehension of language.
Communication disorders can take different forms. For example, changes in speech, the use of language, the sound of the voice, and the capacity to hear and understand language.
And you lose all confidence in yourself. Even when I was getting my voice back with, speech therapists, you're really scared.
Some patients can still will retain some of the simple words like hello, goodbye, those simple social responses, whereas I've had patients come in with nothing, no verbal language, maybe a few sounds. Sometimes those sounds can change, but sometimes they stay the same. For example, they can say ba, 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 and that's it. And it's really devastating for the patient